Hello, my name is Shilp Shah, and I'm an emergency physician in Youngstown, Ohio. I have a special interest in substance use disorder. I'm involved with the residency program at St. Elizabeth Boardman Hospital, and I particularly have an interest in opioid use disorder and treating it in the emergency department. In this section, we'll discuss diagnosis and assessment of substance use disorders. Let's start with a case presentation. A 24-year-old male presents to your emergency department with cellulitis and abscess of his left upper extremity. While performing a history and physical exam, you suspect that the patient may suffer from substance use disorder. You utilize a screening tool, and the patient screens positive for severe substance use disorder. In addition to providing appropriate treatment for his skin and soft tissue infection, what are the next steps in diagnosis and assessment of his substance use disorder? In this section, we'll discuss diagnostic criteria of substance use disorder, provide examples of diagnostic tools used for assessment of substance use disorder, and we'll describe components of comprehensive assessment. We'll also provide an overview of brief intervention and referral to treatment. The DSM-5 defines substance use disorder as a problematic pattern of use leading to clinically significant impairment or distress. This is manifested by at least two of the following criteria within a 12-month period. For example, a patient experiencing increasing tolerance to opioids and who experiences withdrawal symptoms in the absence of opioids would qualify as having a substance use disorder, more specifically, opioid use disorder. The DSM-5 criteria also allows us to stratify the severity of substance use disorders into mild, moderate, and severe. Mild substance use disorder is defined as having 2 or 3 of the DSM-5 diagnostic criteria. Typically, these patients have a minimal impact on their social and physical health from their use, and they are at low risk of developing social or health complications. However, substance use disorder is a progressive disease, and if they progress to a moderate or severe substance use disorder, they may incur further complications. Moderate substance use disorder is defined as having 4 or 5 of the DSM-5 diagnostic criteria. Their use creates a moderate impact on their social and physical health, and they begin to accumulate health complications as well as social complications from their use. Severe substance use disorder is defined as having 6 or more of the DSM-5 diagnostic criteria. This creates the most significant impact on social and physical health, and ongoing use is typically detrimental to the patient. Several tools are available to aid in assessment of a patient who screens positive for a substance use disorder. These tools offer various advantages and disadvantages based on one's clinical setting. You should consider your own clinical setting when deciding on using an assessment tool. The Alcohol Use Disorder Identification Test, or audit, contains 10 items and takes about 2 to 3 minutes to complete. A score of 8 or greater is both sensitive and specific for alcohol use disorder. A score of 20 or greater can indicate dependence and also may have implications on a treatment plan when considering the patient's potential for withdrawal. The Audit C is a 3-item abbreviated version which asks the patient 3 questions. How often do you have a drink containing alcohol? How many drinks containing alcohol do you have on a typical day when you are drinking? And how often do you have 6 or more drinks on one occasion? The Drug Abuse Screening Test contains 10 yes or no items. A score of 3 or above warrants further investigation and indicates a moderate degree of problems related to drug abuse. A score of 6 or greater indicates a substantial or severe degree of problems related to drug abuse and warrants intensive assessment. The Alcohol, Smoking, and Substance Involvement Screening Test, or the ASSIST, contains over 80 items. This length precludes its widespread use. However, in the appropriate setting, it can provide additional information that's useful for assessment and discussion during brief intervention. The Substance Use Brief Screen contains 4 items. It asks the patient, in the past 12 months, how many times did you have or use tobacco, 4 or more alcoholic drinks in a day, any illegal drug including marijuana, or any prescription medications recreationally? For each item, a response of never represents a negative test. Any other response represents a positive test and warrants further investigation. As a means of diagnosis for substance use disorder, laboratory testing generally has low utility, as a drug screen only represents a snapshot of the patient's use rather than an overall pattern. However, in the acute setting, lab testing may be helpful to identify the cause of undifferentiated symptoms that a patient may present with. The use of a validated screening or assessment tool is likely to be more fruitful in providing information that will help a discussion rather than discussing serum or urine drug screen results. Comprehensive assessment is a critical piece of treatment planning for patients with substance use disorder. At some point during the initial phase of treatment, a fully comprehensive assessment should be performed. This is typically performed by an addiction medicine specialist. However, in the acute setting or in the primary care setting, a more brief and focused assessment may be more clinically appropriate. Comprehensive assessment includes data obtained from clinical interviews, physical exam, and diagnostic instruments. Physical exam may indicate sequelae of substance use or withdrawal. Examples include physical stigmata of cirrhosis in an alcoholic patient, or exam findings suggestive of injection drug use or the many complications that it can lead to. Additionally, a patient's vital signs should be examined to assess if they indicate acute intoxication or withdrawal from a particular substance. A mental status exam may indicate substance-induced or co-occurring mental health disorders, such as psychosis or depression. A medical, physical, and substance use history is also helpful and may assess potential for withdrawal. A history of the patient's prior treatments for substance use disorders and their response to those treatments may help guide future treatment planning. Also, allergies, current medications, and social histories should be obtained as well. It is important to identify assets and barriers to engagement in treatment. This includes access to vital services such as case management, social work, peer support, and addiction medicine. Family support and social support networks should be utilized to optimize treatment outcomes. One should also consider a patient's social determinants of health, such as homelessness, incarceration, or poverty. The patient's comorbid health and psychiatric conditions should be considered as well and factored into treatment planning. Brief intervention includes assessing a patient's readiness to engage in treatment. Readiness to change is categorized into 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. The clinician's approach should be direct, empathic, and non-judgmental. While abstinence is recommended, depending on the clinical circumstances, any positive lifestyle choices should be supported and encouraged by the provider. A patient who screens positive for a substance use disorder warrants brief intervention. Part of this involves assessing the patient's readiness to engage in treatment. If appropriate, this may also include initiating and/or referring the patient for treatment for his or her substance use disorder. Let's go back to our case of a 24-year-old male with cellulitis and abscess that resulted from injection drug use. While screening the patient for substance use disorder, you learn that he uses IV fentanyl daily and that this is likely the cause of his skin and soft tissue infection. You use the drug abuse screening test as a diagnostic tool, and the patient has a high score suggestive of severe substance use disorder. You perform a brief assessment to gather pertinent information regarding the patient's history and prior treatment attempts for opioid use disorder. During brief intervention, it is noted that the patient is in the contemplative stage of readiness to change. You provide him with a prescription for medication for opioid use disorder, treat his soft tissue infection, and discharge him home with referral to peer recovery support as well as addiction medicine. Diagnosis and assessment of substance use disorders is a key part of managing substance use disorders. Although a comprehensive assessment may not be feasible in certain clinical contexts, it should occur at some point in the early phases of treatment. After a positive screening for substance use disorders, providers should utilize diagnostic instruments, brief intervention, and referral to treatment in order to optimize outcomes for the patient.